Hello, humans. This is Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. Gotten some questions recently about using secure messaging apps in the healthcare environment. Now that we're all in our work from home environment with telemedicine here to stay, healthcare providers are looking for additional ways of communicating with their patients remotely. And they're asking about apps, secure messaging apps like WhatsApp, like Signal, other consumer grade apps that are built for privacy, built for security, built for private communications. And they're asking whether these apps can be used in a healthcare environment, either to communicate with patients or to communicate among the care team about patients, transmitting PHI via these encrypted, secure, private messaging apps. The first thing that we look at anytime we're asking about using software or services in a healthcare environment is whether or not we can get the required HIPAA business associate agreement for the service. And in the case of these consumer grade software solutions, a business associate agreement is simply not an option. Some people have been arguing that that's not necessarily an insurmountable hurdle, that the secure technology means that we don't need a business associate agreement to use these apps in the healthcare workplace. The idea is that with end-to-end encryption, there's no possibility that the vendor could snoop on our communications. Therefore, it's really just a conduit of data, and it's not a business associate, and a business associate agreement is not required. I'm somewhat sympathetic to this technological argument, but we have to understand and know that the Department of Health and Human Services takes a very dim view of this argument. In fact, Health and Human Services has issued formal guidance specifically addressing this, and they've been very clear that the use of end-to-end encryption by itself does not necessarily eliminate the need for a HIPAA business associate agreement. Now, I do agree that if the technology works as described, there's very low likelihood, maybe zero likelihood, that the vendor, WhatsApp, Facebook, Signal, could intercept and snoop on these messages if the technology works the way it's being described. But the technology working that way, in order for us to know that, we're relying on an assurance from the vendor, from the software publisher. And those vendor assurances cannot be relied on in the HIPAA environment unless they're documented in a signed HIPAA business associate agreement. That's the venue, that's the vehicle for getting appropriate assurances from our vendors, not a privacy policy that's written on a website, not a white paper that they release, an actual signed HIPAA business associate agreement. And remember, folks, we've been burned by this before. Do you remember when Zoom, the video conferencing platform, Zoom was forced to change their marketing because they were describing their technology as end-to-end encryption? But it turns out it wasn't. They were describing the technology incorrectly. It wasn't true end-to-end encryption, and the Federal Trade Commission forced them to change their advertising and their marketing to be more truthful and more accurate about how the technology works. Now, those of you in healthcare have a business associate agreement with that company, and so you're covered. But if you had been relying solely on that assurance about the technology, an assurance that turned out later to be inaccurate, all of your communications over Zoom would have constituted an impermissible disclosure, and you would have been left hanging in the breeze. So we can't be relying on assurances from vendors except in the form of a HIPAA business associate agreement. And that's what we're doing when we rely on end-to-end encryption. If it works the way they describe, you're fine. And there's little risk that anything bad could happen. There's little risk of an impermissible disclosure, but you're still relying on an assurance. And to do so, you can only do that with a HIPAA business associate agreement. That's the rationale behind that guidance from Health and Human Services. And that's why these apps like Signal and WhatsApp are probably not appropriate in a healthcare environment. There are some other reasons, though, why these apps are probably a bad idea for healthcare, and in fact, probably a bad idea in any work environment. I'm going to go into that in the next issue of HIPAA for Humans. So tune in next Tuesday. Join me here. I'm Michael at Matterform. Thanks for watching.